It was a sad time in the history of this country when African Americans were segregated based on the color of our skin.
But you remember that was the time of massive resistance here in Richmond. You know, Richmond had made up its mind. Not only were they not going to integrate the medical facility, schools were closed down.
The marker that says during the era of segregation, it's all in the history, is right in that marker. And it's in the vicinity of the old St. Philip Hospital. And to know that when the last one of us are there, unless somebody take a sledgehammer and beat it up, that it will be there and they will know that we were here. It was the St. Philip School of Nursing. Well, we graduated in 1960.
In 1962, it was a 3-year program. We got a diploma in nursing. They had already made the decision when I enrolled to discontinue the school, but I didn't know that at the time. They allowed one more class to come in. Although we were segregated, I think the same standards were set for our school that had been set for the MCV school nurses. There were very few St. Philip nurses who failed the state board.
We had to improvise and reuse, what they say, recycle and reuse. That's what we did. That's exactly what we did. We didn't have linen to change beds sometimes. And the nurses talk about having to sharpen the needles instead of having needles available to change when you gave
Disposable
injection.
needles. We didn't have disposable.
You didn't have disposable anything. You had to wrap up, do all the syringes, and use the sterilizer.
It was either 67 or 68. I was working as a staff nurse at St. Philip Hospital when they got a call from Washington and told them they had to integrate in 48 hours, else they were going to take the Hill Burden grant away. That's a big grant that came from the federal government for medical facilities. So they literally rolled the patients through the tunnels. You know, there are tunnels that can connect these buildings. They literally rolled the white patients to the black side and the black patients to the white side, and the nurses had to do the same thing. And I remember coming to work that next day and my supervisor approaching me, asking me to go to the 15th floor of MCV. I had a lot of admiration for her. She was quite an influence in my life. And I think I mostly did it because she wanted me to do it, not because I wanted to do it. It was difficult. There were a lot of rejections over there. But, I wasn't rejected by everyone because I was the only black nurse on the floor. But I remembered what Miss Lacey told me. You're going over there to give those patients the best care possible, like you're doing these patients over here. I kept that in my mind, and that helped me to forget the rest of it. It was a practice then, if the doctor wrote an order, rather than to leave the order written, he would always bring it to the RN to explain, to make sure she understands what it was. So there were some doctors who just refused to talk to me. They would just throw the charts, on the desk. And I had to decipher them the best I could. But I never made a mistake from what they had written down. I understood what they had written.
I had a physician come on the unit one day and he said, "Nurse, I need you now." And I said, "Excuse me? I need you in here now." And I said, "Just a moment." Oh, he came barreling over there. "I need you now. And I'm going to report you." I said, "My name is A. Vaughn. There are 2 A. Vaughns, Ann Vaughn and Alethea Vaughn. Please tell them it's Alethea Vaughn." And I went on doing what I was doing.
And if he had done that to me, I'd have been shaking in my boots.
She would have. He came back the next day. "I want to apologize for yesterday. I don't know why I did that." He said there was no excuse for that. And I said, "Apology accepted," and I kept on going.
If I went to go out to get something to eat, you couldn't sit down in the restaurants. If you went in to order something, you'd order it, you'd stand, you'd wait for it, and you'd leave. But one time we went in this little ice cream parlor that was right up on Broad Street, near the campus, and we were ordering for several people back at the dorm. So we went in there, and my friend didn't sit on the stool, but she leaned against it. And the lady was in the midst of fixing all of this. And she said, you can't sit down in here. So we waited until she finished all of these things.
And then left it, I hope.
And then we told her to keep them. And we went out and just laughed. And every time we walked by there and would see her, we would just.
I was the first black nurse the Henrico Health Department ever had hired. And they laughed at me and said, you can't go there because they don't hire black nurses. And I said, watch me. So I went to Henrico Health Department, and when she finished interviewing me, I said, if I'm not hired, please be prepared to tell me why I'm not, because I'm probably just as good as any nurse you have in there. And I left and I thought, what did I say? Well, 2 days, I got the job. I got the job. And the nurses would go and get in the little corners and they get in the room and plan the weekend, and I got tired of that. So one day I swung the door open, walked in there, and I said, I don't even want to work with y'all. So it's no big treat for me to work with you, so I don't want to socialize with you. So you don't have to try to hide and plan your weekend. And shut the door and came out, and then they try to invite me to everything. It's just it's uncalled for. I mean, just because my skin is different from yours doesn't mean I don't have the same feeling. If you cut me, I will bleed, even though one nurse at Henrico Health Department didn't believe it. I told her that if you cut me, I would bleed green blood, and she believed it.
I'll leave you.
Yes, I did.
There was one instance of a cancer patient who had pain, and I guess this was around 5 or 6 o'clock that he needed his pain medication. But he didn't realize I was the only one on the floor who could, administer the drug. And he just said he couldn't take it from me. So he just turned it down until 11 o'clock. At 11 o'clock, a white nurse came on to relieve me. And he just stayed in pain until she got there. I felt sorry for him because I knew he was in pain.
I was traveling with my husband. I stopped at the service station to get gas. And I saw this white man looking at me, and I thought, what did he want? So he came to the car and he said, aren't you a nurse at the St. Philip Hospital? And I said, yes. And he said, oh, hold on just a minute. And I thought, is he going back in there to come out and shoot me? What is he going to do? He went in there and he brought me out 4 sets of glasses. And he said, I had wanted to find you and give you something, because he said, people think that people of color can't do anything. He said, but I had the best experience that I could ever have in a hospital. And I thought that was awesome. I didn't even remember him, but he remembered me.
My parents' advice was, you just have to know who you are. Don't let anyone dictate to you who you are. As long as you know who you are, don't worry about who they think you are. And that's what got us through. Because there are a lot of mean, ugly people in this world. And they're mean and ugly for different reasons. Some of them are taught that way. White friends who have told me later in life that had they never met me and decided to become my friend, they would have never seen blacks in that perspective.
If I held grudges, it hurts the person who's mad. It doesn't hurt the person that you're mad at. So, and I never wanted to live my life that way. Things happen, the times were different. Things have changed now, but I'm always wanting to speak out so that will not happen to anyone again.